So I urge everyone to follow the new public health orders, wear your mask, and most of all, if you are eligible, please get vaccinated as soon as possible. I'm going to turn over to Dr. Shaw for some further comments on the importance of vaccination and what we are seeing in our ICUs.
Thanks, Derek, and good morning, everyone. I want to build on Derek's current comments that encourage everybody to get vaccinated. Unfortunately, what we are all facing is controllable and preventable. Nearly 84% of all new infections and hospitalizations in our province in August were in unvaccinated or partially vaccinated people. A recent analysis of over 1,600 diagnosed infections show that 98% of school-aged children with COVID live in households with unvaccinated or partially vaccinated parents. People who have chosen to remain unvaccinated are 6 times more likely to test positive, 6 times more likely to be hospitalized, and 12 times more likely to be admitted to an intensive care unit. More than 70% of our ICU patients are admitted fighting for their lives due to a single preventable diagnosis: severe COVID pneumonia with lung failure. We now have enough inpatients from COVID to fill both the Swift Current and Prince Albert hospitals combined. And the numbers of hospitalized patients are growing rapidly, all that pressure from a single preventable disease. If everyone who is eligible for a vaccine got both doses, we would be able to manage the demand. Instead, we are facing service slowdowns that Derek spoke to, and this is having a real impact on the quality of life and health for many across Saskatchewan, and it will result in real harm. But worse, if this continues, the life-saving supports all Saskatchewan citizens rely on will be in danger. The highly skilled healthcare personnel we rely on day in and day out for those services are a finite resource. I work in the ICU, and it's already heart-wrenching to watch people die from a largely preventable disease. And to add to that heartache, any need to make decisions about life-saving care for all of Saskatchewan residents only build and add to that tragedy. So please, if you are not yet vaccinated and are eligible, please say yes. Ask good questions of your family physician, your pharmacist. Challenge all the misinformation that is swirling around and causing real harm to so many of us. And if you are fully vaccinated, please encourage others to do so as well. Help them to find good information and a vaccine clinic. Thank you. Please, as always, stay safe. And I'm going to hand it back to Amanda now to help moderate questions.
Thanks, Dr. Shaw. Thanks for your comments, and also you as well, Derek. Before we begin the Q&A session, I just want to begin with some housekeeping notes. If you have a question, we ask that you please click the hand icon by your name. You'll be called on when it's your turn. Your line will be unmuted, and you'll get one question as well as one follow-up question. Alternatively, you can ask your question in the chat box. You can type it in there, and it will be read aloud on your behalf when it's your turn. And we have a number of people on the line, so we ask that you please limit yourself just to one question and one follow-up question, just to make sure we can give everybody an opportunity here today. If there is still time at the end and you have a third question, you can use that hand icon and we'll do our very best to accommodate you. Also, in order to make sure that we're allowing our leaders to get back to their urgent work related to pandemic response, we're going to do our very best to cap the Q&A to about 20 minutes, and we thank you for your support in that. So with that said, we'll now begin. Linnell, do we have any questions on the line?
We do, Amanda. The first one's from Nathaniel Dodge. Nathaniel, go ahead.
Hi, can you hear me okay?
Yes, we can.
Okay, thank you. Dr. Shaw, you previously said that doctors, frontline healthcare workers are coming very close to having to use ethical frameworks to decide who gets medical care in the overcrowded ICUs. Are we there now? Are people receiving suboptimal care because you're overwhelmed and need to make tough choices?
I think the people who are currently in our intensive care units are getting really high quality care. It's the people that we've had to choose to not do their surgeries because they've needed an intensive care unit bed for part of their post-operative care, are the people that I know are not getting the care that they were waiting for. And so I think that already is one of those allocation decisions that we've needed to make. And we make those when we're in stage 1 of the allocation framework. As numbers continue to grow, we will continue to try to expand our ICU capacity as best as we can. But the finite resource are skilled healthcare personnel who work in the team that provides care to the ICU patients. So as we grow and expand the team, the models of care do need to shift. And at that point, I do think that what we're doing is not the usual standard of care. It's still going to be high quality. It's still going to be safe. It's just going to be different.
Thanks, Dr.
Okay.
Shaw. Nathaniel, did you have a second follow-up question?
Yes. Now, we know adult patients are being transferred to the children's units. Are adult COVID patients in any other units right now? And does this put Saskatchewan children at risk?
Well, I'll start, and I think Lori Garchinski will be better positioned to add to build on my answer. So right now, our critical care patients are being looked after in the ICU, adult ICUs across the province. And then I'm also very grateful that we have our pediatric intensive care unit team who actually stepped forward and said, we have capacity, we think we have the ability, we know, and I know they have the ability to take care of selected patients, either with or without COVID. And we do have several people who would traditionally, they are called adults and they would be traditionally in our ICUs. But as part of the team response, I'm very grateful that our PICU team is balancing, always making sure that there's space and expertise available for children all across the province. And then with the additional space that they currently have and the additional capacity, they are taking selected patients. Lori, I imagine you would have something else to say in answer to that question.
Yeah, thanks so very much, Dr. Shaw. Appreciate the question. Nathaniel, to your point as well, the PICU takes very seriously their responsibility to dealing with children. And we have not seen a significant amount of impact in pediatric patients, gratefully, that are requiring PICU resources. But our goal is always to ensure, and the responsibility of making sure that children of Saskatchewan have access to the PICU. To Dr. Shaw's point, when we began some of the planning for surge capacity, as mentioned, our PICU partners did step up to the plate and said that they definitely would work with our adult intensivist colleagues and, where appropriate, select adults that could be adequately cared for in that PICU. I would just add that one of the other surge plans is the fact that in Regina, there are intensive care patients being cared for in the cardiac care unit, and we have been able to support surge capacity for those cardiac care units in other places. It really is a bit of shuffling the deck in terms of being able to make sure that we have access as much as possible, along with that infinite human resource capacity that Dr. Shaw spoke of.
Thanks for that, Lori, and thanks, Dr. Shaw. Linnell, who do we have next on the line?
Next, I have Zach Becerra. Zach, go ahead.
Good morning, Dr. Shaw and Ms. Garchinski. I'm wondering if you can quantify how many surgeries have been canceled or postponed because of this surge planning, and if you can also speak to the cancellation or suspension of the Saskatchewan organ and tissue donation program.
I'll start just to say I don't have the numbers of how many people across the entire province have had their surgery delayed. I think that's rapidly unfolding as the directive has come out to delay cases that are scheduled outside of the cancer, urgent, and 6-week window. I will ask Lori to speak to the rest of your question because I think I've actually lost what the question was. Sorry, Zach.
That's okay. Hi, Zach. Thanks very much for the question. In the contemplation of service slowdown and human resource allocation, often our organ donation coordinators are the ones that also come and have critical care experience. So due to the significant surge, particularly in Regina and Saskatoon, and the need to maintain those standards of care and support, we have slowed down and will provide only immediate tissue donation, particularly for some of our ocular patients. We're just working through that process right now, but yes, unfortunately, that has been one of the side effects of the surge capacity management that we've had to do to support ICU care in the province.
Thanks, Lori and Dr. Shaw. Zach, did you have a follow-up?
Yes, Ms. Garchinski, maybe just so I'm clear, does this mean that somebody who is registered to donate other organs and who passes away tragically for whatever circumstance, if that person comes in and they have viable organs, what happens to those organs right now?
So unfortunately, Zach, with the suspension of our program, it would mean that unfortunately that gift and that registration that they so kindly provided would not be able to come to fruition. We would continue to manage them and support them with end-of-life care, but we're very saddened as a province. There's been significant work done to manage the organ donation program, and we're super grateful for all the families and people of Saskatchewan who have made that decision to donate. Our resources, however, right now have to care for the intensive care patients that we're dealing with.
Thank you, Lori. Linnell, who do we have next on the line?
I have a written question here from Phil Tank that I will pose on his behalf. What are you expecting over the next 2 weeks in terms of hospitalizations and ICU admissions, and what effect will that have throughout the province?
It's Derek here, and I'll just maybe take a stab at that one. So as I mentioned in the opening comments, we are still planning towards the targeted surge capacity that was shared last week, 125 COVID ICU beds, and also 350 non-COVID acute care, or non-ICU, sorry, acute beds for COVID patients. And so those capacity figures remain in place. We are seeing fluctuating demand on a day-to-day basis, and so it's prudent for us to prepare for this scenario. While we do have an understanding of potential trends, we can't predict really what's going to happen in the next 2 weeks. We are seeing, as I mentioned, some increased demand in rural and in Regina. And so we're I guess changing and adapting to be able to meet that. But ultimately, we don't know what the 2 week projection might turn out to be, and I guess that's where it kind of comes back to our residents of Saskatchewan. The key things that each of you can do if you're eligible and unvaccinated, you can get vaccinated, and that's so vitally important to all of this. And otherwise, obey the public health orders, wear a mask, and carry out all those normal safety practices that we've adopted over the last many months.
Thank you, Derek. Linnell, who do we have next on the line?
I'll just go back. Phil did have one follow-up question in that, and it's, are we close to needing help from outside the province as we saw with Alberta?
So I'll respond to that one as well. So our intent right now is to activate our surge plans and all the various slowdowns, redeploy our staff in order to achieve the capacity that's been established for us. As part of that, of course, we are looking for other potential contingencies. And we have normal processes where we move patients out of province, for example. It's just that's a normal I guess, way of moving patients to where they can get the care that they need. So we know that is an option, a contingency. Our plan right now, though, is to continue with the surge activation that is being mobilized as we speak in order to meet the demand.
Thanks, Derek. Linnell, who do we have next?
Next I have on the line Nikki Jurek. Nikki, go ahead.
Yeah, I'm here. I understand that, this number fluctuates, but how many people are in the ICU today for both COVID and non-COVID patients?
Hi, Nikki, it's Lori. I can tell you at present, our current capacity as of 11:30 is 84 patients in the intensive care unit. 60 of those are in for COVID-related admission.
Thanks, Lori. Mickey, did you have a follow-up?
Yeah, we're starting to see, as you mentioned earlier in the statement, that, hospitalizations in Regina are increasing, and as is in the South. What happens if Regina gets to a situation that Saskatoon sees itself in? And are we close to, you know, having that surge capacity?
So I think, Derek, if it's all right, I can start with that. I guess I can tell you from the standpoint of critical care to Derek's comments that EOC has provided us a goal of 125 surge capacity spaces for the province for ICU patients, and then likely the additional 50 for some patients that do not have COVID-related admissions. As Derek has mentioned, the service slowdown does allow us to redeploy staff, some who have critical care experience, some who have been upskilled through the course of this pandemic, and we're just in the process right now of expanding those. There are, at this point in time in the province, 24 additional ICU surge beds that are open in our regional or in our tertiary sites. The goals and the conversations between the Emergency Operations Center and the local incident command groups in rural North Regina and Saskatoon continue to look from their expanded capacity as where they can go to next and what manpower strategies they would have to go to that. So we're not at that point in time yet where, from a Regina rural standpoint, we do not have ICU capacity, but we are strained. Keeping in mind that this pandemic has been going on for a substantially long amount of time, and I think there was a lot of hope for frontline folks and likely Saskatchewan residents as a whole that the vaccination campaign would get us out of this. Unfortunately, the challenge is still seeing unvaccinated admissions throughout the province continues to create stress and challenges for our frontline staff, and it does force us to move into additional surge spaces and capacity and management of care that is already strenuous on healthcare providers, physicians, respiratory therapists, folks that are actually just very, very tired.
Thank you, Lori. Liddell, who do we have next?
Next, I have Lara Fomino. Lara, go ahead.
Lara, are you there?
Lara, you're on mute.
Yes, I am. Thank you. Can you hear me okay?
Yes, we can. Yeah.
Okay, wonderful. My question is, where are the employees, have the staff who've been redeployed to, for instance, the PICU in Saskatoon or to ICUs across the province, where are they coming from, and are they adequately trained to work in an ICU?
Yeah, thanks so much, very much, Laura, for your comment. When we do our service deployments and service slowdowns, those staff and through our human resources look at the qualifications of the patient, of the staff members that are actually put into the labor pool. We do have critical care trained staff who have left and pursued other opportunities within the SHA. So dependent upon the time frame that they have left the intensive care unit, it might be a short brush up, it might be some orientation and support going forward. We also have areas where there are either observation units, high acuity beds, opportunities where staff from other locations have had some level of experience. Over the course of the last 18 months, we have done a lot of work with upskilling some of those staff and allow them to come and help support the intensive care unit. Compounded with that are the other areas that come with service slowdown. If you are a registered nurse, if you're a licensed practical nurse, if you're a respiratory therapist, you have a scope of practice that we are attempting to maximize to really provide an all-encompassing teamwork approach to this. So there are some staff that have been floated from some medical or surgical units that may not necessarily have intensive care support, but they do have a scope of practice. They do have an ability to provide help in terms of supporting for turning, repositioning, management of some appropriate medications, other care delivery methods that are within that level. And really that work and multidisciplinary approach of dealing with a large number of patients is the way that we are supporting our surge capacity currently.
Thank you, Lori. Lara, did you have a follow-up?
I do, yes, thank you. There is, ask the health ministry an anticipated shortage of some COVID medication, anti-inflammatory medication that's anticipated in a couple of weeks. How do you potentially see that affecting patient treatment, COVID ICU patient treatment in the coming weeks, given that ICU capacity has to be increased and there are more patients in the ICUs every day?
I can start with that. It's Susan. So you're right, and I've spoken to this before. There are a few very selected group of therapeutic drugs that have been shown to show some impact on the recovery course of people with a COVID infection. There's a high demand for those medications all around the world because of the pandemic and because we have so many people with COVID infections. How the drugs are allocated is done at a federal level with allocations coming into the province. And then what we do is we work really hard with a team, a therapeutics experts panel that looks at what are the criteria to make sure that the right people are getting the right medication for the right indication. And we have order sets, we have decision supports, we have tools available to physicians and pharmacists to make sure that we're using the medications appropriately, really trying to make sure that it's used in the best way possible. If I want to order one of those medications, I have to actually consult with a pharmacist, and together we make a decision as, is this the right drug for this patient? Is it safe? Is it likely to be effective? That's what we can do right now to make sure that we're making best use of a very precious resource. I do worry, and this is, when you look at finite resources, the medication supply is something that is outside of our direct control, which again makes it even more important that everybody does everything they can to stay safe, to be vaccinated, to wear a mask, to avoid large gatherings, everything you can do so that you don't need one of these medications, because there is a potential we could run out, and that's the reality. We do everything we can to make sure we're not wasting a drug, and I'm very confident that the teams are making sure the drugs are used as best as possible, but we could run out.
Thanks, Dr. Shaw. Linnell, who do we have next?
Amanda, I'm going to call on Alexander Kwan. Alexander, go ahead.
Hi there. I'm just wondering what the path forward over the next couple of weeks looks like. Are things going to get better or are they going to get worse?
I'll say that the demand that we're seeing in our hospitals right now, including in our intensive care units, it really is derived from the cases that we saw 10 to 14 days ago. And so what we've seen since then is a continued increase in cases per day. And so based on that, we are anticipating our demand in our hospitals to continue to increase as well. We are hopeful that the public health orders that have been introduced will start to bend that curve and ultimately lead to a reduction in demand in our facilities. But we are continuing to surge to increase our capacity, as mentioned earlier, in an anticipation of ongoing growth in hospitalizations and ICU census. So all of this really emphasizes the need for people to make the right choice about vaccination, to follow the public health orders, wear a mask, and so on.
Thanks, Derek. Alexander, did you have a follow-up?
Yeah, I just wanted to follow up on a question about the PICU use. Can you confirm that there is COVID-19 patients currently at the PICU, or is it just other ICU patients that don't have COVID-19?
Thanks very much for that question. I can confirm with you from an adult standpoint, there is one COVID positive adult in the PICU, and there is one other adult that is admitted for another condition. As of 12:45 yesterday afternoon, there was one additional PICU patient that was COVID positive at that point in time. The remainder of the patients in the pediatric ICU were there for a variety of other reasons.
Thanks, Lori, for that. Linnell, who do we have next on the line?
Next is Gabriella Panza-Beltrandi. Gabriella, go ahead.
Yes, just following up a little bit on that actually. With some children's ICU beds being reserved for adults, does the SHA anticipate more children to be hospitalized in the next couple of weeks? How will care for them be adjusted to meet demand? Stuff? How will that kind of work?
Yeah, thanks so much, Gabriella, for your question. So when there is consideration of an adult patient being placed in the pediatric ICU, there's a number of conversations and discussions that occur. Firstly, between the pediatric and the adult intensivist in terms of determining the appropriateness if that patient, generally a single system disease, has the ability to be managed and supported in the PICU. Secondly, similar to what the adults do or a neonatal does, we look at our overall occupancy. How many patients are in the unit? How many patients would we be progressing to believe that they would have capacity to be transferred out? And what is our bed staffing along with HR resources? So it really is a combination of factors. It's not just a carte blanche that so many beds are designated for adults in the PICU. It is a case-by-case discussion, and it really is important to understand that, excuse me, the pediatric ICU team, as well as I think the SHA as a whole, understands the responsibility for the management of pediatric ICU care, and that will always be the first priority.
Thank you, Lori. Gabriella, did you have a follow-up?
Yes, I was just wondering, in Saskatchewan in general, how many kids currently are being treated for COVID-19 in hospital, and are there unique challenges to treating younger patients, like under 12 age?
I don't have knowledge as an adult ICU doc about how best to look after small children with COVID, and I think we'd be able to perhaps connect you with somebody who is able to speak to that. I don't know that Lori or Derek would have anything to build on follow-up questions.
Gabriella, I can take that question away and touch base with you at a later date on that.
I guess, Amanda, the one thing that I can just provide is the fact that I know we are looking at making that a bit more transparent on our dashboard and the ability to ensure that that information is available. Again, fortunately, up until recently, we have not had a significant amount of pediatric patients that have required PICU care. But I think as the teams are going forward and we're understanding this, we want to make that information transparent as well.
Thank you, Lori. Linnell, who is next?
I'll call on Lisa Schick. Lisa, go ahead.
There, maybe now you can hear me.
Yes, we can.
Okay. We're hearing that doctors are quite concerned about the slowdown and the effect that it is having on their patients, especially given that a lot of things weren't able to catch up after the last healthcare slowdown. Just wondering how that and, the fact things weren't able to catch up is factoring into decisions about care and the realities of people needing care in the province.
I can start. It's Susan Shaw. I think everybody is very concerned, and I share the concerns that I've heard directly from many physicians about what the very large numbers of people in our hospitals that we need to care for immediately and plan for in the days ahead. The impact of that across the entire province is massive. And I think that's one of the main points that I tried to make in my comments when and I want to keep emphasizing. This is, whether you have COVID or not, we are slowing down services that are going to impact you or somebody you know, not because we want to, but because we have no choice. We have people presenting with severe COVID, and without their care, we know that they would not do well. They would literally die, and we don't have a choice. We have to be ready and able to look after those people, recognizing massive impact on the health and wellness of the rest of the province. That's why it's so important that we are all vaccinated. Everybody who is eligible needs to protect themselves from COVID, and they need to protect the healthcare system so we can be there for you. Right now, we know that we're not there for everybody, and it's no choice. We have no choice.
Thanks, Dr. Shaw. Lisa, did you have a follow-up question for us?
Yes. At this point right now, I know you guys have said that you're kind of in the process of slowing things down, but at this point right now, which procedures are being stopped, not being performed, and as we continue on, which ones are also being taken off the table? Like, at what point are we in that slowdown?
I'll maybe start off on this one. So with the instructions that were provided last week to our teams, we are ceasing all elective surgeries and procedures. And so we are continuing to provide emergent cancer and 6-week urgent surgeries and procedures. And so that's being implemented as we speak. So across the province, patients would be notified of those changes. And then we would be taking the steps to redeploy staff to where we need them, such as the ICUs and in other COVID services. So that's in progress. I will also say there are many other services in the community and primary healthcare and other outpatient services that are also being slowed as part of this in order to free up staff so that they can be deployed perhaps into acute care, but then also into our testing sites to support vaccine, contact tracing, and those types of COVID services in order to keep up with the demand. So in addition to the, I guess, the surgical side, there are many services in the community that are also being slowed down in order to make sure that we have the resources available to meet the COVID demand. Not sure if Dr. Shaw or Lori have additional comments.
Well, I'd just like to build on that. The first one is that I think we all recognize that elective does not mean unnecessary. And so the word elective means that it doesn't need to be done emergently or urgently. So we really do worry a lot and recognize the burden this is creating on so many people. The other thing I want to emphasize is we are still here for you if you need urgent and emergent care. And I really don't want anyone to stay away if they think they're having a major illness or a sudden change in their health. Seek care, call 911. We want to be there. We are there for you. It's very safe to come in and have care inside our hospitals and our emergency rooms. Yes, we're busy, but we're focusing on people with acute and emergency services that need our care. So don't stay away. Please be understanding that not all care is continuing, but our emergency and urgent care is here for you.
Thanks, Derek and Dr. Shaw. Do we have any more questions on the line, Linnell?
I have one last set of questions from Pat McKay. Pat, go ahead.
Thank you. We had heard that adults had been in the PICU at actually many different times in the pandemic, maybe not consistently, but absolutely before this fourth wave. Can you confirm that?
It's Susan.
Yeah, thanks so
I
much.
would say it's not many. I would say that intermittently since early 2021, and Lori may have more details, but since early 2021, this has been a plan that's always been in the background, and intermittently, certainly the PICU has been incredibly helpful on a case-by-case basis, taking primarily young adults that have single system or single system problems, meaning maybe there's just car collision or an infection or a COVID infection, and looking after them. So that's, I don't have a number for you. I think it's been about 3 in the last kind of couple weeks, but across the whole 2021 version of this pandemic that we've been through, the PICU has been very helpful on a case-by-case basis.
Yeah, thanks, Dr. Shaw. I guess I would just add to that, throughout the history of the PICU, when there have been young adults appropriate, there has been some admissions into the PICU to assist the adult teams when they were nearing capacity. So I do just want to echo that, we've all come together as a team to really help. And I think it's important to understand that, there really was, from a PICU perspective, keeping in mind we must provide care for pediatric ICU patients. You've heard us talk a little bit about service slowdown and deployment. There was a conscious decision not to deploy PICU nurses out of PICU for that very reason, to ensure that they are there and they are ready to care for PICU patients when required. However, as Dr. Shaw has mentioned, when there is some level of capacity and there is an appropriate conversation and a selected patient population, they have been a huge part of our team to be able to care for additional COVID or non-COVID young individuals that may not have normally been in that ICU, but do take the load off of the adult ICU for all of those COVID and or non-COVID patients that we are asked to care for.
Thanks, Lori and Dr. Shaw. Pat, did you have a follow-up question?
Yeah, just one, if you were able to put a number on just how many adults have been in the PICU throughout the pandemic.
Pat, it's probably difficult for me to give you an exact number. I would say to you over the period of time, there's likely been less than 10.
I would agree it's less than 10, but I don't have an exact number.
Great, thank you both for that. I want to thank the news media for participating in this call today, and of course to Derek, Lori, and Dr. Shaw for making the time for this. That concludes our question and answer session for today, and we will now disconnect the call. Thank you.